Assalamu alaikum and welcome to Health in Islam. I'm Ismaeel Chartier and today we'll be talking about AIDS with Professor Dr. Abdul Misbah, Professor of Immunology and Microbiology and a Fellow of the American Academy of Immunology. I'd like to start out with a hadith of Muhammad sallallahu alaihi wasallam where Abdullah ibn Umar radiyallahu anhuma, may Allah be pleased with them both, said that Muhammad sallallahu alaihi wasallam said to the people who made hijrah from Mecca to Medina that 5 things would happen in his ummah. And the first one of these things was fornication would become rampant, and you'd have to know that this has never happened before without new diseases being introduced that were not there in your forefathers. This hadith reminds me of AIDS because AIDS is something that is new after the sexual revolution. So, Doctor, thank you for coming and being with us today. When was AIDS firstly discovered? Where did it come from? And how was it transmitted?
Bismillah ar-Rahman ar-Rahim. Actually, AIDS, the first AIDS case was discovered in California in summer of 1981. But that wasn't the first one, actually. When they returned to the stored blood in Africa, they found that there was a stored blood positive for AIDS since 1959.
Oh, subhanAllah, 59.
Yeah, but it didn't spread. They said a lot of theories actually explains how it came out or explode like this, but nobody can confirm one of them. Some of the theories said that it's transmitted to us from the green monkeys.
I've heard this one.
Yeah, in Africa. And a genetic mutation has happened to make it infect human being. And it was like SIV or simian immunodeficiency virus. Another theory explains that they did the polio vaccine over the tissues of these monkeys, and that's one of the modes of transmission. Actually, it's there. It won't benefit us to know where it came from, but it's there. The modes of transmission actually is through sexual intercourse. This is the major mode of transmission, and by the way, it's 80% of this is from a man to a woman or vice versa. I mean,
It's a natural heterosexual
sexual intercourse, not the homosexuals. It started in the homosexual, but now
it's moved to
heterosexuals. The other mode of transmission is through blood transfusion or
intravenous drug use
or blood products, blood transfusion needles like IV intravenous drug abusers. Of course, the blood products like hemophilia factors, red blood cells, plasma, these things actually, if it's contaminated, all sharp things like needles, like tattooing, like piercing ears for rings, if it's transmitted from an infected person to another. And the other way is from the mother to baby in 15% of cases, but now we have drugs which reduce.
Let's block that. That
reduce this incidence actually.
What is the total number of HIV-infected patients all over the world? Because it is a worldwide epidemic.
Yeah, actually, this is, as long as we said, this is the AIDS virus, and this is of 2 types, HIV-1 and HIV-2. And here in the graph, we have the HIV-2 in west of Africa, and it's less dangerous, less severe
than
HIV-1. Actually, your question is the number, about the number. It's at the end of 2004, it's 39.4 million.
39.4 million people worldwide infected with AIDS.
Every day, every single day.
These are the known cases. These are the reported cases.
There is 8,000 people get infected, newly infected cases.
8,000 people a day newly infected with
You
AIDS.
know, as we are talking right now, every 10 seconds, a man all over the world, in some place in the world, get infected with
He's getting infected with AIDS right now. One man. Right now, one man.
You can count. We have actually people living with AIDS, and by the way, 39.4 million is the people who are living. There are people who died from AIDS. So the sum of the AIDS cases which get the disease actually exceeds 60 million since the beginning. The newly infected cases in 2004 were 4.9 million. 4.9 million
million people
in
last year.
2004 who died from AIDS. And this is the new AIDS cases. The deaths from AIDS, 3.1 million.
3.1 million people died last year of AIDS, and 4.4 million people became infected with AIDS last year.
As you see over here, most of the people over here in sub-Saharan Africa, it's 25.4 million. In the Middle East, it's 540,000. Also, we have over here in South and Southeast Asia, it's spreading a lot. It's 7.1 million.
Wow.
And we have a very rapid spread of AIDS over there. In Latin America, 1.7 million. In Russia and Eastern Europe, 1.4. Actually, we have 4.9 new AIDS cases in 2004, 3.1 million of them in sub-Saharan Africa.
So sub-Saharan Africa is definitely the worst.
Yeah, and the deaths over there is 2.3 million last year, just last year. So we have children also in sub-Saharan Africa. We have 1.9 million children
a year dying from AIDS.
Yeah, living with AIDS in 2004. The total number actually of children died from AIDS in 2004 is 640,000 children
in sub-Saharan Africa.
Yeah, actually we said that about 14,000 new HIV infections a day in 2004. I said before it was 8,000.
Yes.
In 2004, it became 14,000 new HIV infections a day.
14,000.
14,000,
new.
Yes.
Do you think with the amount of education, I know in the West, AIDS education is everywhere. You can't turn on the TV or turn on the radio without hearing an ad about AIDS education. Do you think that there needs to be more AIDS education in sub-Saharan Africa? Do you think this is part of the problem, is the education?
Well, a lot of problems, you know. I am one of the people who are doing the strategy for the AIDS in Africa. We have a group called the African Leading Priorities of AIDS, representing the people of Africa who put the strategy to combat AIDS. And I found a lot of reasons for that. It's lack of informations, lack of knowledge, actually the stigma. A lot of things actually take part in this spread, severe spread, lack of access to medications. And this is a very important issue.
We keep all the medications and the good ones in the West, and we send the bad ones to Africa.
Yeah.
When does it become from HIV to AIDS? When does that switch happen?
Actually, when it starts its manifestation, there are around 25 criteria, 2 of which could define that this patient actually has AIDS. But if the symptoms appears, that's a sign that he has AIDS. Actually.
Now, what is HIV? We've talked AIDS, but what does HIV stand for, and what does AIDS stand for? Because they're acronyms.
Yeah.
Let's throw that out just in case people are like, okay, AIDS. Everyone knows AIDS, but what does it really mean?
AIDS means acquired immune deficiency syndrome.
Okay. And
This is the initials.
And HIV?
HIV, human immune deficiency virus.
Okay.
And by the way, it was first discovered in 1983 by Gallo in America and Montagnier in France.
And they called it something else when it first came out.
LAV, lymphadenopathy-associated virus. And he said LAV3, and one said HTLV, and they agreed that both are the same, so it's called HIV.
Okay.
Yeah.
This is a very important subject that we're talking about, AIDS. And we'll be right back with our guest, Dr. Abdul Hadi Misbah, Professor of Immunology and Microbiology and a Fellow of the American Academy in Immunology. We'll be back in just a couple of minutes. Jazakallahu khairan for watching, and I'm Ismaeel Chartier. Assalamu alaikum. Assalamu alaikum, and welcome back to Health in Islam. I'm Ismaeel Chartier. The Prophet ﷺ said there are two things that people take for granted: health and leisure. This show is about health, and inshallah ta'ala, you'll have some leisure watching it. Our guest today is Dr. Abdul Hadi Misbah. He's a professor of immunology and microbiology and a fellow of the American Academy of Immunology. We've been discussing AIDS, which is a huge topic in the whole world. The whole world is affected with AIDS. There's not a country, a city that doesn't have this problem. The question I have for you now is, how does the virus affect the human body?
As you see in the diagram in front of us, the HIV structure actually consists of RNA, it's ribonucleic acid, and a coat, which is GP120.
GP120?
Yeah. GP120 actually has spikes, these spikes which we see. These spikes, and this is the immune system, actually the other army in front of it. As you see, the HIV over here, and this is the immune system cell, which is the T helper cell. The T helper cell has receptors. It's like, you know, the key inside the locker.
It has the exact teeth. That
The
go into
exact teeth, yes. And so the GP120 search for the CD4 on the T helper cell, and also we have some receptors discovered later called chemokine receptors. So it has two lockers, not just one.
Not just one. It's looking for two things when it attacks.
And it has to be fitted on both to enter inside the cell. As we see over here, this is the virus and this is the T helper cell. When it invades the cell, it takes off the coat, and the RNA inside is changing to DNA. And this is the milestone of its life cycle. You see, and this actually incorporated inside the nucleus of the body cell itself, the immune cell.
So it changes the RNA to the DNA, so it becomes
involved
in everything.
In everything. So it becomes dormant over here, and it uses the immune system cells to replicate.
Oh, so it uses our army against us.
That's correct. And then it explodes, as you see over here, to give multiple viruses after using the immune system cell. In our body, you see some people get infected and they stay for a long period of time, and nothing happened. Where is the virus at that time? It's over there. As you see in the lymph nodes, there is a battle going on, in the lymph nodes. And the lymph nodes has something called follicular dendritic cells. It's trying to trap the virus from getting out.
It's doing like a pincer move. It's surrounding it.
From getting out into the blood. So the first single symptom of HIV infection is enlargement of lymph nodes, like over here in the neck, sub-axillary, or something like that. As you see over here, you have this lymph nodes before it's destroyed by the virus, and you see it has been destroyed over here. So as we know the life cycle, we have the how to interrupt this life cycle actually, because it's very important to interrupt this.
Is that where the AIDS cocktail comes in to interrupt this
Yeah,
life cycle?
that's quite correct, yeah.
And that keeps it from growing. What are some of the symptoms of this disease besides the lymph node swelling? You know, I've read that there's you become sick very easily. You die from the flu usually, or from pneumonia.
Right.
So what are symptoms if you find yourself becoming sick all the time? Should you get yourself checked out? If you have no energy, what are the symptoms?
Actually, the symptoms starts with at the beginning of the entry of the virus. It's just like flu-like symptoms. Some sort of fever, some sort of lymph nodes, enlargement, malaise, something like that. Then, in the dormant state, which could start
last for years.
For years, like 7 to 10 years. Nothing except this. Then it starts for actually the second stage. There's loss of body weight, less than 10% of the body weight, and easy fatigability.
Tired very
minor subcutaneous manifestations like herpes zoster, which lasts a lot, recurrent upper respiratory infections.
Okay, you get a lot of
like
chest
cough,
colds.
chest colds, and something like that. Then, in the third stage, we find loss of weight more than 10%. In the fourth stage, we find like tumors, Kaposi sarcoma, a lot of infections with viral candida in the mouth, like moniliasis, upper respiratory tract, diarrhea, loss of weight, a lot of things, lymphomas, dehydrations, sometimes HIV encephalopathy.
When does it become from HIV to AIDS? When does that switch happen?
Actually, when it starts its manifestations, there are around 25 criteria, 2 of which could define that this patient actually has AIDS. But if the symptoms appears, that's a sign that he has AIDS. Actually.
Now, what is HIV? We've talked AIDS, but what does HIV stand for, and what does AIDS stand for? Because they're acronyms.
Yeah.
Let's throw that out just in case people are like, okay, AIDS. Everyone knows AIDS, but what does it really mean?
AIDS means acquired immune deficiency syndrome.
Okay. And
this is the initials.
And HIV?
HIV, human immune deficiency virus.
Okay.
And by the way, it was first discovered in 1983 by Gallo in America and Montagnier in France.
And they called it something else when it first came out.
LAV, lymphadenopathy-associated virus. And he said LAV3, and one said HTLV, and they agreed that both are the same, so it's called HIV.
Okay.
Yeah.
Now, are there any treatments for such a rapidly spreading disease?
Fortunately, yes, but it's very expensive, and this is the problem. You know, the AIDS is spreading in the poor countries, and the producers are the rich countries. So it's not fair to restrict.
Can you put a price on life?
Yeah.
Yes, we can.
Yeah.
that's basically what they're saying.
Yeah, that's correct. See, in the diagram over here, we find that how can we interrupt the viral replication over here, and we can interrupt the entry by fusion inhibitors, as we said, the key and the lockers. So we keep like wax instead of getting the key into the locker. And then we have also a group of drugs like over here called reverse transcriptase inhibitors and protease inhibitors.
And this would be the cocktail, as they
yes.
call it in America.
Yes, that's correct. We aim to maximal and durable suppression of HIV RNA levels, the copies of the virus itself, and restoration and preservation of immunological functions, improvement the quality of life, reduction of HIV mortality in these patients. Actually, it's very successful treatment, and we are trying actually to make poor people get access to these medications.
It's very important that they
and The United Nations actually is making a project called 3x5, which is aiming to make this cocktail therapy reach to 3 million people by 2005, and it didn't happen.
It was like
Yeah.
it's 2005. What's the best prevention for AIDS? Obviously, don't commit zina, which is, sex without marriage. Stay away from risk factors like homosexuality and drugs, things that are all outlawed by Islam. Other things that are good prevention, like from keeping away from HIV and AIDS?
I think, yes, the most important thing is knowledge. We have to know how it's transmitted. This is the...
Iqra.
Of course, our religion prevents sex
Without marriage.
without
Yeah.
marriage. So this is a kind of protection. And in the Western culture, of course, you know that people who invite or declared the sex revolution in the 60s return now to say just faithful partner. Yeah, of course.
All the intoxicants, al-khamr, are haram, are outlawed, forbidden for us. And you see a lot of AIDS transmission through intravenous drug users, through heroin shooters.
Yeah,
and
this
coke
is
shooters.
another thing. If you want to kill yourself, don't spread AIDS. Use a disposable syringe. Because, you know, this is a very important thing, because the addict needs to get the shot with, regardless its cleanliness, its
he needs his drug more than he needs, he
sterility
cares
or
about the
anything like
cleanliness.
that. The other thing is don't use sharp instruments like the teeth
Pick your teeth.
extraction or picking or something like that. All should be disposable, and the piercing of the ears and
All should be thrown in the
tattooing,
trash after it's done. not
those
reused.
things should be disposable also.
Jazakallahu khairan, ya doctor. Thank you very much, and may Allah bless you for what you've helped us learn today on this disease. And inshallah ta'ala, we'd love to have you back for another show.
Inshallah.
Our guest today was Dr. Abdul Hadi Mesbah. He's a professor of immunology and microbiology and a fellow of the American Academy of Immunology. I'm Ismaeel Chartier. I'm just the host. Until next time, assalamu alaikum wa rahmatullahi wa barakatuh.